Right now, we've got our incident command center up. We're walking through everything we need to do to make sure we have everything that the public will need from a standpoint of provision of care, dealing with any increase in the number of patients that we're going to have coming in. We're also standing up drive-thru testing, which is something that we've gotten up as early as 9 o'clock this morning. One of the things that we're dealing with right now is we're only able to deal with electronic orders coming in. We don't have it set up where people can bring in paper order sets from their providers, which has been a little bit problematic, and we're trying to work through this, but we're trying to avoid the exchange of information or material between our caregivers and the patients. So we're in the process of trying to give the patients more access to electronic media, like our virtual platforms, where they can get orders put in via electronic means into the system, so that when they arrive here, that we can provide them the test. That's probably the biggest thing that we've done today from a standpoint of bringing things up. Our incident command center in the Midlands market in Columbia, they've brought up online testing as well. Once again, it's by virtue of electronic orders already in the system. We can't do the test without the order of a physician, which is a really critical piece that the patients need to hear. Walk-ups requesting a test is not going to be something that we can do, at least not right now. And we're trying to get a little bit more able to help with being able to take orders by other means other than our internal record system. But until tomorrow, the next day, we don't anticipate being able to change that to any significant degree.
We did talk to someone who went to a family doctor. They said this morning they were given a paper order, and then they came here. But at this point, what would you say to people who do have paper orders?
If you have a paper order right now, what we would request that you do is go to our virtual visit platform, and it's free using the COVID-19 code. And what we can do is have our providers on the virtual visits put the order in through our system. And at that point, when you come in for your drive-up testing, we will have at least an order from an internal electronic source that we can access and provide the service to you. There is a limit, obviously, to how many people we can process in a day. It's not a significant problem right now. If you're not sick and just want to know, I would recommend you don't come in for a test. If you're having symptoms, you've been to your provider and they've requested or suggested that you do this, go to our online platform and use that to get into the system so that we have an order that we can use when you get here.
Are there any, say for instance, somebody tests positive when they come through these drive-through testing, what is the next step for that?
I'm glad you asked that question, because that is a critical piece of why we need them in the system. We have to have a way to communicate with these patients. It's imperative that we have contact information and access to be able to call them back, especially if they test positive. So it's not something we're trying to do to inconvenience anybody. It is truly to provide the best level of care possible for the patients.
Is there anyone, in terms of like somebody has asthma or grave disease, are there any other patients or people out here that might be at a more so risk of kind of getting this virus that's going around, or anybody that should be a little bit more worried than others with the virus going around?
The overall risk of getting or contracting the virus is essentially the same for everyone to a large extent. The degree that the virus causes illness within that individual is variable depending on the comorbidities or other health problems they may have. It's significantly more difficult for the older population, just like flu. The elderly tend to fare poorer with flu than the younger do. This virus is not a lot different in that regard. But from a standpoint of your risk of contracting the virus, everyone pretty much suffers from the same overall ability to be infected. If you avoid people that are obviously ill, if we all stay we're social animals, and if we want to reach out and shake hands and do all of those things, it's very, very difficult. It's difficult for me not to do it. But it's something that we need to do over this period of time. The less physical contact we have, the less tight spaces we accumulate in, the more we can socially distance ourselves, 6 feet or greater as a rule from one another, which is something we're just not good at, but we need to get good at it over the next several weeks to a month or two so that we can slow down the spread of this virus. Physical contact, droplet transmission with sneezes and coughs from infected patients are essentially how we spread it to one another.
With this virus, since there's no vaccine as of yet, is this something that can reoccur in someone if they get it and they can get it more than once?
We don't know that yet. We suspect that won't be the case. A lot of viruses, most viruses, once you've acquired an infection and recovered from an infection with it, you gain an immunity. That's largely what we do with vaccines. We expose you to a part of the virus that the body can recognize and attack, and the vaccine makes you immune. So we think that you'll get an immunity from this, but this is something new. It's just like any new flu virus we deal with. There's always nuances to it. I think probably what we're going to see long term is we are seeing people recover from it. We're pretty sure they're becoming immune to it, and I don't think it's going to be any different than any other virus we deal with.
In terms of the testing out here, how long does it take to get results for negative or positive tests?
We have 48 hours usually. We are going to hopefully be bringing up internal testing in the next, hopefully 2 weeks. If we do that, we'll have hours to turn a test around. The other reason it's critical that we have contact information with patients is even at a 4-hour turnaround, we still have to call you back. With the 24 to 48 hour turnaround that we're looking at right now with these tests that we're running with between the CDC, DHEC, and our outside labs, we certainly need to be able to reach you a day or two later. The one thing we would tell anybody, if you think you need testing and you are tested because you feel like you're ill, go home and self-isolate until we can get you back a result. Regardless of whether it's the flu or if it's COVID-19, self-isolation decreases the spread of either virus, and it's something that we need to do just for the benefit of the overall public.
And last question for me here. Is this something we should be more worried about than the regular flu?
Not really. Yes and no. I guess is kind of a non-answer. But yes, you need to be more worried about it from the aspect that we don't have an immunity to this virus right now. It's just like any new flu virus. We've actually had significant flu outbreaks in the last 25 years. Every once it's over like swine flu. We didn't have a vaccine to that. We had no overall immunity in the population to that. It's going to be somewhat like that. There are going to be people that get ill with it. A lot of people won't even notice it. Some people will feel like they've got a cold or a little bit of an achy fever and they'll get over it. The vast majority will do that, just like the flu. They will become immune and move on. There will be the minority of patients that will get significantly ill with this because they don't have immunity yet. And those are the ones that we're having to get prepared for. What we're seeing in the overall global view of this is when they do get sick, they get very, very sick sometimes. And what we're trying to do, just like any flu virus that we have not had prior vaccinations for, we're having to plan for the worst and when we really expect it to be more like a standard flu. So overall, I think we're going to be fine. I think this is something that the overall community, especially the upstate community, who is responding incredibly well to doing what we're asking them to do, we're going to do much better than a lot of communities. But we are planning to be able to deal with things if we don't have that good an outcome. And I think all the hospitals in the Upstate Coalition are working together very, very well to make sure we are more than prepared to deal with whatever happens with respect to this virus.
Is this a virus that, you kind of touched on it there, that depending on who you are and how your body reacts, we're just going to see one extreme or the other?
No, I don't. You're not going to see extremes. You're going to see a continuum, just like you do with the flu. The vast majority of us gets a little bit achy. We don't feel good. We get a headache, low-grade fever, and we go on and we don't even notice it. There are a lot of people with this that are like that. There's some that get a more severe case of it, and they have to go home, go to bed, maybe need some antibiotics for a little post-flu pneumonitis. And then there's the other extreme, which is the minority, or the gross minority, who get extremely ill, require extended hospitalizations, and may even go to the point of needing ICU care. So I don't want the public or anyone to think that this is one extreme or the other. It's just like every other viral illness that goes through the population. You'll see a continuum of response to it, the vast majority of which will be on the I don't feel too good today part of it.
You mentioned earlier that the process requires our service provider to go through the checkpoint to do the for y'all system. What about the people who don't have a service provider? What's their process to actually?
Right now, one of the things that is very, very important is we need them to go through our virtual platform if they do not have a relationship with one of our Prisma Health providers as of the present day. The virtual platform serves to get them into our system so that we have orders when they show up for the testing, if they qualify for it. To be clear, everybody does not always qualify to need to be tested. If it's just I'm curious, have I got it? I haven't felt bad. I still don't feel bad, but I'm just curious. Please do not request a test. We need to request a test for those that truly need to be tested right now.
What would you say to someone who isn't sure whether they should be tested? Is it the nausea, fever? I mean, is that something that you'd recommend to go get tested?
Not necessarily. I would check with my provider. I would check, if you don't have a provider in our organization, then check with whoever your provider is. I know that everybody in Upstate Coalition is trying to get this up, and we're all doing it exactly the same way. It's going to be by order of a physician. And a lot of times the physicians will talk to the patient and say, you know, let's see how you do in a few days, and we're going to put you on something else. We'll treat you for what I think it is, and if we're still not better in a few days, we'll send you in to get tested. So, like I said, it's not dissimilar from the way we would manage somebody with the flu.